first of all and foremost, this has been a challenging day for many. This has been a celebratory day for many, and it's been an indifferent day for many. And I am just grateful that you are all here to have a conversation on how we can move veterinary medicine forward with the results of what happened. So for that, I want to cheers you all for being here. Thank you so much. And what we'll be able to do is start in, because I do think there's going to be a lot of questions. I promise you all, as soon as we get him to be able to come in on the next section, we will talk about Colorado. I know that's a big issue. But Katie, if you could kind of give us just this basic overview of what control means by the houses, et cetera, and just give us that general overview without going into the specific bills themselves.
Mark's coming on.
Awesome.
Great.
Ah, Mark. Okay. I unmuted him. I already did your, wait, he's got to unmute. I already did your toast, so we are officially jumping in.
Okay, you know what? Get my comments early because this Wi-Fi today has been on and off all day. Cox Mobile's trying to fix it somewhere nearby, but anyway.
Well, this is the most important part. First, we're going to have Katie give the overview, and then we're going to jump into Colorado. So let's let Katie go first, and then we'll jump into Colorado.
So really quickly, I'm sure everyone has seen the, results at the top of the ticket with the Republicans gaining control of the presidency, and also now the U.S. Senate, the U.S. House is still being counted. But where we are really working and what we're talking a lot about today are state level results. And so at the state level right now, there are still a few key states being counted. But the really big news right now is that it's a very low cycle change environment. We have only seen 2 states actually flip a chamber in control. So far, Michigan has flipped from D to R in their House of Representatives, and Minnesota has now tied in one of their chambers. And both of those are unique because they have broken the trifecta of Democrat control in those states. So Michigan and Minnesota are looking a little bit more purple now when it comes to their actual state chambers. This is very unusual because in most election cycles, we see up to from anywhere from 11 to 12 chamber switches flip. So it's very interesting that there are only 2 notable ones right now. Pennsylvania, Arizona still have some big state races that are very close, too close to count or too close to announce. But that is news in itself, that we are not seeing much change when it comes to the control over the chambers in the state legislatures. What is really interesting is that NCSL, the National Conference for State Legislators, is predicting up to 30 changes in state chamber leadership, which is a really big amount. It's a large number, meaning that the Senate presidents and the House speakers are likely to turn over leadership. And that could really trickle down into how veterinary bills are introduced, because when a new House Speaker comes on or when a new Senate president comes in, it typically means that committee leadership changes. And so that's really notable for us because we typically see, a lot of longstanding, Senate leadership or House leadership controlling, bills like veterinary bills or any animal related bills. So having that much change could have a really big impact. So that's sort of the overview nationally at the state level. I don't know if there are any change or any questions about that.
So one question I had on that, does that mean that it's going to take longer on that state level to get issues pushed forward because of those changes? Or does it mean it's not going to be as challenging because that is 30 considered a lot or little?
It's considered a lot. And the answer to your question in terms of changes is we'll have to wait and find out who those new leaders are. We could be getting more leadership in those chambers that are very friendly to pet issues. So they're going to put a lot more in their committee. They're going to push a lot more of those bills forward. Alternatively, we could see some leaders change that have historically seen and promoted a lot of animal related legislation who new leadership isn't so keen to do that. So and what's notable about those is those elections within the chambers don't typically happen until January. So we won't know more about that change in leadership until January, but the predictions from NCSL coming out this early, stating that there could be up to 30 is quite a large number.
That's huge. I guess I didn't realize that. I thought you would know that already. I didn't realize that that actually pushes until January.
Yeah, it's usually when they go into session, right after they go into session, the Senate leadership and the House leadership will caucus with the primary party and vote a new leader in.
So is that, so it's a nail biter for you all, right? Because you don't know where things stand. And then do you guys hit the ground running really hard then in January once that's determined?
Yep, absolutely. So we absolutely hit the ground running in the states where we're working proactively on legislation. We are eagerly looking to the leadership in those chambers to find out who becomes the leader and how that landscape might impact pet legislation.
So any questions for Katie on just this topic on the leadership by state that you might have before we move on to our next issue? I just want to make sure so we get that covered. Okay, I'm seeing no hands.
You
Okay.
can always put your question in the chat if you don't want to
Absolutely.
say it out
Absolutely.
loud. And we'll-
Okay, so Mark, let's dive into very specifically probably one of the most controversial topics that occurred as a result of yesterday's election, and also kind of give the impact of what it means. So why don't we dive specifically into and get like really granular here on Colorado?
Thanks. And Catherine, can you hear me? I'm on my phone. My Wi-Fi has been.
We can hear you.
Thanks. Appreciate it. So one of the aspects of voting that increasingly everybody experiences if they still go to the polls or they vote by mail is propositions or amendments that voters vote on directly on issues. And they have the effect of law. And you're kind of working around the legislature and the voters are deciding for themselves what they want to approve or not approve. Proposition 129 in Colorado passed by a 5 percentage vote margin. And I've been involved in the veterinary and pet healthcare industry since 2006 in Congress, as it turned out. So it was always somewhat political. And this is the biggest battle we've ever had of this sort. And unusual isn't strong enough word to describe that this even occurred. But it, because the legislature would not consider the idea of creating a veterinary PA, essentially a veterinary animal health version of a human medicine PA. The supporters of that went to signatures to get on the ballot, which itself is a very expensive activity. It can take up to $1 million to do that because you pay people to be your signature gatherers. In a state like Colorado, it's not easy. And it became a ballot measure that was opposed. Different organizations don't support the PA idea. We've had lots of articles. I won't get into that across the veterinary media, but there was roughly $1 to $2 million spent by veterinary organizations opposing this measure. The supporters raised money and had advertising as well. And it passed by a 5 percentage point margin, which is a pretty meaningful margin. And I was not surprised that it passed. This was pro-consumer legislation. You know, put aside your own feelings about it and wherever you stand or sit in the pet healthcare world. When you have consumer-friendly legislation, that is legislation that gives consumers something they don't have right now or more access to something. And obviously a PA in the human context is a professional that many of us use and see whenever we go to the doctor's office, to a hospital. PAs have been around for 60 years. So it wasn't available, of course, on the veterinary side. And so when you have a consumer-friendly ballot measure, it's tough to defeat that. And it was mainly passed in the urban areas, in the suburban areas in Colorado, Denver, Colorado Springs, Grand Junction, areas like that. And it was highly controversial. It's obviously contentious. I've been involved, as a lot of you know, heavily with telemedicine activity. And this became quickly in the last year more contentious, if it's possible, than the issue about telemedicine. Telemedicine is played out in legislative actions, you know, passing in the last year in California, Florida, and so forth. And you'll hear more about that later from Katie and Lauren. But what happened yesterday in Colorado is significant, and whether it makes you happy or unhappy, you kind of need to know the implications of this. There's two implications. Number one, in Colorado, what happens next?
Yeah.
The state agency, and it's the agency that oversees government regulations, if you will, and administrative agencies. The state agency inside of which the Veterinary Medical Board exists, it will be passing rules and regulations to implement the law. And the law creates, in simplest terms, a veterinary clinic version of the PAs, physician assistants, that we have in human healthcare. And that's a public process. I would be very surprised if the principal opponents of the ballot measure, the AVMA and the Colorado VMA, aren't going to be very active in working on the implementation. And that can be friendly or not friendly, depending on what those organizations decide to do. The supporters, obviously happy that they won, will be involved in implementing the regulations. And that's going to take some time to implement. And that is going to be a public process. You'd probably like me to say everything's going to calm down. There's not going to be a lot written about this, and we're not going to have the kind of public fight, which is unusual for the veterinary world to have. But I don't think that's the case. I think too much was invested in this to have the people that lost give up, and have the people that win not want to push it all the way through to implementation. That's it. That's effect number one. That's the result number one. But this also, because it was the first and such a unique thing to have the veterinary profession involved in a ballot measure, which got a lot of attention, including New York Times nationally, as well as all the media in Colorado. The victory serves as kind of a 200-mile-an-hour hurricane. I hate to use hurricanes for those that live in that part of the country, but it's like a 200-mile-an-hour force of wind behind this issue now, meaning that particularly blue states like Colorado on the West Coast and the upper Midwest and New England and on the East Coast, blue states are going to look at this as a very consumer-friendly idea that supports access to care. It could lower the cost of care. It could reduce shortages, which I'm not here to debate tonight, but I'm just saying you can expect that this isn't going to stop in Colorado. And so you're now going to see a number of states, I suspect as early as next year, 2025 and beyond, begin to take up the issue, just as states like California and Florida saw what Arizona did with telemedicine, and they too pursued it. So it's the maturing of this industry, to be honest with you, as someone that does this for a living, when you have interest groups step up, private nonprofits, shelters, trade associations alike, and want to have a say and kind of battle it out on policy. It means you're maturing and you're more important. As we all know, pet healthcare has become much more important. But you have to get used to the fact there'll be disagreement. This isn't going to go away quietly. There may be negotiations, and it becomes something that everybody rallies around. On the human side, the medical associations fought it. It's been legal for 60 years. Really, 4 generations of people have been PAs in the US. Same thing for nurse practitioners. So things work their way out, just like telemedicine was fought. And it ultimately led to adoption on the human side. And we're in that process right now on the veterinary side. So let me pause there, Catherine. That's a mouthful I gave you. But that's kind of an overview of what's going to happen next in Colorado with implementation through rulemaking, public process with the state agencies, not the legislature. And then other states clearly are going to look at this, and depending on the politics of that state, take a run at it. And I would put a lot of money on that definitely happening as early as 2025.
So there is going to be a few questions that come through on this. And again, we're going to put political views aside, just really trying to understand some of this. So I'm going to ask a first question, and then Morgan has a question that goes in this as well. So since it is open now for the public to review, you mentioned that those that have been potentially opposed to this, can they actually help put a little more confines around it? I mean, I know what was written out there has folks a little concerned, but can that now change? If it was voted in what are the limitations of what can,
Yeah.
like, where's the
Yeah.
guardrails?
That's a great question. You don't get a second bite at the apple. It was voted in, it's law now. Colorado will implement this, and it'll implement this consistent with the terms of the legislation itself. And because you don't like something, at the end of the day, when the votes are counted, your complaints about that and your objections are basically done. You know, you've had your chance. Candidates win and lose, and same thing with ballot measures. But so the implementation, Catherine, has to be carefully aligned with the legislation itself. But it's a good process. It's a chance for people not to say it's a bad idea, don't do this, but to work on how it's going to work. And because we have the model from human healthcare, which Colorado makes great use of PAs on the human side, it would be the very rare hospital. I'm not sure there would be one in Colorado that doesn't have PAs in it. You know, I get my medical care. I'm lucky enough at Mayo Clinic in Arizona. I often have a PA, not an MD, treating me, and the outcome's been very much to my satisfaction. I just say that as you've got a model now, which the legislation, and you'll have interest groups like Colorado State, which is proposing a program for that. You've got the big animal welfare organization, Denver Dumb Friends League. You've got the Animal Welfare Association in Colorado generally, of all the shelters around the state. So a lot of experts will be at the table, and the AVMA and the CVMA, Colorado VMA, will be welcome too. But you can't go in and stop it. You can go in and you can try to argue about what implementation means. And that's a lawyer-driven process, but it's one that is public.
See, perfect timing. You got cut off. So get ready, Katie, to or Lauren to jump back in. But let's let April ask her question. Then I want to bring Morgan's question in. So wait, what happened, April? I just
right
had
here.
Oh, there you are. Okay, thank goodness. You jumped on me.
Sorry. Hi, everyone. I don't really have a question. I just want to say that I've been leading the VPA initiative in Colorado, and I just want to let everyone know that even the animal, all of us are really invested in creating guardrails around
So
it.
April,
it's
can you
not
tell
like
people who you are though, so that people know?
Yeah, so
you're just
I'm
April.
Dr. April Steele. I'm the president and CEO of the Dumb Friends League. I'm also a veterinarian that practiced for 20 years in Denver. I've served in the House of Delegates of the AVMA and was president of the CVMA. Like, I have both sides of this conversation in my head all the time, right? So we are highly invested in creating guardrails, both sides of the conversation. This isn't organized veterinary medicine against animal welfare trying to do this. So we tried to go through the legislator. The reason that didn't work is we had one legislator that blocked all entry of all bills relating to this. And so that's why we went with the ballot measure, which is something none of us wanted to do. It's not a good use of resources at all. And we're hoping that because we did it, no one else has to do it. There's a much better collaboration when you do it legislatively to create those types of guardrails. But there are things like how many BPAs can a DVM supervise? Is it surgery outside of a body cavity, like abscesses and mass removals and things like that? There's all kinds of things that could be on here, but we're highly invested in making it successful and finding the best ways to implement it. So I'm happy to answer questions people have.
So I know Morgan has one. Morgan, do you want to, where are you at, Morgan? I'm going to unmute you. So I would love for you to ask your question specifically of Dr. Steele. I just sent you a little like unmute button. She had put it in the chat. Oh, there she is. Okay, go ahead.
So I put two questions in the chat, but my first one was in comparing it to a human PA, PAs in human medicine, all PAs are humans, but they don't do surgery on humans, as far as I've ever been aware, right? But the proposed veterinary PA would be doing various types of surgeries on animals.
Yeah,
And
so
my other
do you want me to
question,
answer that?
just related to that is what might the legal liabilities end up looking like for the veterinarians that are going to be in charge of supervising these veterinary PAs?
Yeah, so some human PAs do surgery, especially hand PAs do a lot of surgery. So it's not with the, it's not done. But this is a different way of deploying a PA. The interesting thing is the curriculum, which has been maligned unfairly, that the CSU is putting together. has more preclinical surgical training for the VPA than it does for the DVM students. And it has 3 times as much dental training for the VPA as the DVM students. So the training will be there. They wouldn't be expected to do orthopedics and extensive surgeries, but your liability question is interesting. And I'll tell you how I answer it, and then I'd love to hear how Mark answers it too. But right now, a DVM is liable for a veterinary technician. And because of a lot of the demand on what practice needs to do, veterinary technicians are often, at least in Colorado, I'm sure elsewhere, being asked to do things that are actually prohibited by the Practice Act. I'm not against that. I'm just saying that that's a thing, whether it's a tooth extraction or seeing a patient without VCPR in that moment or whatever that looks like. So the liability really comes in was when you do something that is in violation of regulations. Most liability insurance say as long as you're not violating the Practice Act or the law, you're covered. And so the other thing about liability I think is really important to remember is we think it's a good guardrail to have. We do not want a DVM to be able to have 15 VPAs and delegate everything and go on vacation, or whatever that looks like. It's a guardrail to say, we're only going to delegate if we know this person's competent in doing this. They've demonstrated to me, I have assurance that they're going to be able to do this well. And then the third thing I like to say is we've had a couple professional liability insurance companies reach out to us and say that they would very much like to provide liability insurance policies directly to VPAs. In human medicine, the insurance companies love PAs because they have much lower complaints and much lower costs and claims. And so it may not be the most thoughtful thing to do because if there's stacked liability policies, and that's a good place for a lawyer to search and to sue. But it is also an opportunity, perhaps.
So I just want to say, we didn't know April was going to be on here. How wickedly cool. We got April on here. So she's able to help address some of the questions since Mark was jumped off really quick. He's back on now. Any other questions on this topic? Because we do have quite a few more to go through, but I want to make sure we're using your time as efficiently as possible, but giving, oh yes, go ahead, Doug, Dr. Doug.
Yeah, what's I mean, realistically, right? I mean, seeing something along the lines of like these new vet schools that have come in and the timelines of what they're actually predicting to see students come out and make a difference in the workforce theoretically, right? I mean, I'm in South Carolina, so obviously Clemson's going to get one, and that's happening in a lot of states. I mean, what's the timeline that you expect to see this actually come to action? I mean, I would assume there's going to be a pretty big lag in regards to establishing an actual curriculum and then actually implementing that at a school or multiple schools, and let alone them coming into the workforce. I'm assuming we're probably still, I guess, yeah, that's the timeline. I have no idea. Years from the possibility of this actually coming into play.
Actually, we're much further along. Oh, go ahead, Mark.
Well, I'll just say in general, you can expect that a good part of 2025 will be rulemaking and the implementation side. But and at CFSU and perhaps other programs, Lincoln Memorial University has a master's in veterinary clinical care, and they'll be, I'm sure, interested in whether their students could be licensed in Colorado. So, you sort that out over the course of a year or so, and I don't think the state's going to want to drag that out. And then CSU, April, do you have a feeling about when they'd prepare to admit students?
So CSU is on their 21st step of 21 steps in their approval process. So they've been working on this for about 2 years. I'm happy to share their curriculum and their prerequisites if you're interested. It's not what you've heard. It's over 400 hours of in-person labs, all kinds of things. So they expect to be able to have their first class start in fall of 25. And have their first graduates about 5 semesters later. So it's about 3 years from now. And yes, the legislative rulemaking process will coincide with that, but we actually do believe that there will be graduates in about 3 years from now. That will be probably a small class. We're probably 15 to 20 people. It's not going to be huge. It's not going to overwhelm any systems, but it will grow over time. And
so
yes,
I'm really
others.
happy, April, you just said it's not what we've heard. I do think many of us, me included, have heard the 60 hours. So when you say 400 hours, my pulse suddenly went down. So I have
Yeah.
to say that I think that that's really important for across the industry. So I may be asking for that curriculum so we can help share that out a little bit.
Yeah.
I do want to make sure that we are building a bridge, not simply creating a
Yes.
forest fire. So we can be doing, I want to make sure that we're doing and really understanding the full curriculum. 400 is very different than 60 as we're looking at those hours in general.
Yeah. Yep. And that's the in-person part. There's all kinds of things. Happy to share all that information.
I would love that. One of the questions that just came in privately to me was, how are the technicians in Colorado specifically reacting? Minusing the big organizations. We know they have publicly made statements, et cetera. We are fortunate to work with a lot of technicians, but I am curious, like, what is in just the pulse of Colorado?
Super important to us too. So it's interesting. We have actually CSU announced their program, put all these FAQs on the website, and they have been inundated with veterinary technicians that want to do this program, like overwhelmed, years worth of enrollees to do it. And right now, their program is going to require a bachelor's degree because that's what CSU requires for their master's degree program. Hopefully over time that will evolve a little bit, have prerequisites, but not necessarily a master's. Personally, I've had a lot of technicians reach out to me, maybe 30 technicians reach out to me saying how excited they are about having a
That's
career
a class
path.
or two.
Yeah, a class or two, how excited they are. I have technicians that work in our organization that want to go to the VPA school and do this. They just don't have, the ability to spend 4 years in veterinary school, but they really think this is obtainable for them. And there's some that are really upset and think it's offensive and think that it's, usurping their authority and going to step on their toes. What I'm really excited about is we fully expect from what we're seeing already that many of these VPAs are going to be former technicians, and who knows better how to fully deploy a veterinary technician than someone who's been a veterinary technician. So I think it will really help with the healthcare team.
So what I'm going to do is I'm going to have us switch topics because we do have to go to the next spicy topic, which we love those here at the Bridge Club as well. So any additional questions that you guys have, go ahead and put them in the chat. And April and Mark, if I could have you read the chat, and even Katie and Lauren, if you guys could be looking and helping address any of those questions that they have. Because honestly, Cheryl, Shannon, and I, we don't know. I'm just going to say, we don't know what's all happening there. So we want you guys to help us out. Okay. The next spicy topic, and Lauren, you're on deck here. I had unmuted you. Let's walk through telemedicine legislation. Mark had given a tease on it, but we know that that is another area that causes a lot of division within veterinary medicine. Talk to us about what came through, what is happening, and what's going to be the impact.
Yeah, thanks. I want to also start out, you touched that this past session, we looked at 2,400 bills. I just want to start by saying when we started our current tracking system in 2017, we were only tracking 100 bills. So these primary issues we started with have increased in volume, but also the scope at what we're looking at has expanded a lot.
So is that because of pet owners wanting to know more? I mean, is that because of the industry, or is the expansion because of pet ownership increasing? I mean, what is the reason for the jump?
I think it's both. So as we talk to veterinarians more and more, we find out issues that are affecting them that we need to look deeper into. And as I go through the topics we have tonight, I'll let you know whether these are newer issues or how much they've increased in the past couple of years. And we've also expanded our scope. So we look at animal welfare, the pharmacy side, anything that's related to vets, pet products, pet care, pet services.
Okay, so you have a couple of topics in hand. So let's spend like 4 or 5 minutes on telemedicine, and then we'll jump to the other spicy one, veterinary technicians. So let's jump forward first on telemedicine.
Okay, so this session we saw 16 bills over 9 states, and we saw bills introduced on either side. So Colorado passed a bill that will require the VCPR to
pesky
be
Colorado. Can we just say that? Can we call it pesky? I'm sorry, April. Okay, go ahead.
And their bill will require the VCPR to be established in person. And then on the other side, we had California and Florida, so our biggest and third biggest states, unanimously passed bills that allow the VCPR to be established electronically. So that now brings the total up to 108 million people in our country who can have telemedicine as their first point of care their first access point. DC also passed a bill, and this would allow all of their health boards to establish care without an in-person exam. It does have a clause, though, that allows their mayor to introduce an amendment requiring an in-person exam. So we'll be tracking this really closely through the rulemaking process at the state board level to see if any changes occur. And in addition to that legislation, we're always tracking state boards on the pharmacy side, the vet side, state registers. So daily, we're looking at this legislation as it goes through the legislature and then to those state boards and to its final process.
So question on that, with the FDA statement about prescription, that does not impact these bills, correct?
Correct. So that's related to extra label drugs, and I can see Mark raising his hand, so.
Go for it, Mark.
There was there's a misunderstanding, and I'll make it real clear. The FDA has not done anything different. It has not passed any new rules. It's not, and many people think that. I'm not going to point fingers except to say an advisory that they sent out caused a lot of people to be told or think that somehow the FDA had declared telemedicine was not legal. They haven't done anything like that. All they've done is more than 20 years ago when the AMDUCA legislation was passed, it brought the FDA officially into approving animal drugs. They made a requirement then because there was nothing else but in-person VCPR, that if April prescribes an extra label drug, that is a drug that it's being applied for a different species than intended. So a human drug, it needs to be an in-person VCPR. They do not usurp state laws that permit for telemedicine, period. It's not a debate. It's not even ambiguous, but there was a lot of misunderstanding, Catherine, about that. And if my voice sounds moderately intense, it's only because I must have had 100 calls in 2 days saying, did they just do that? And FDA doesn't do things quietly. There's a whole rulemaking process that would have been required and very public to make that change. And I think Katie Jarl is going to mention recently what a federal court did. So the FDA's whole view of veterinary telemedicine may change as well, just because federal courts have been asked and have issued rulings that get into this topic. So,
Katie, what do you have to add when he's just called you out like that?
Well, sure. So you, as Catherine, as you said, telemedicine can be a spicy issue, and perhaps the spiciest news in telemedicine of late is the Texas Hines Fifth Federal Court of Appeals decision. So the Fifth Circuit oversees Texas, Mississippi, and Louisiana, and there has been a 10-year-long battle with a veterinarian in South Texas named Dr. Hines, who was performing veterinary telemedicine and has been going through 10 years in the courts with the Texas Veterinary Medical Board because they came down because Texas actually does have a prohibition in state statute on veterinary telemedicine. And so because he was practicing it, there has been a 10-year battle in the courts. Just this September, so about a month or so ago, that Fifth Circuit Court of Appeals ruled in favor of Dr. Hines, saying that Texas's statute on the prohibition of veterinary telemedicine actually violates First Amendment free speech rights. And so this is part of the telemedicine prediction section, but we can absolutely predict that Texas and likely Louisiana and Mississippi will have some sort of address to that in their legislative sessions this next year, given that court decision.
Okay, I just have to add, for those of you who don't know, my daughter went to University of Mississippi, so I'm gonna just say go Rebs at that point. Okay, big SEC family. Okay, so that's wickedly cool. Any comments or questions on this topic before we go? Because I am watching. We have a lot to talk. It's definitely amazing. Any hands? No? Okay. Use it or lose it. As we're going, okay, so April's been posting a few things in the chat. Make sure you're watching that. Okay, so Lauren, you're back up. Let's talk about veterinary technicians licensing and scope of practice. This has been a topic on the Bridge Club several times this year on credentialing, et cetera. So, and I know that we also have Sam Gelling on the call as well. So let's go. Tell us what has happened legally within the bills.
Okay,
Voting.
so this year we tracked about 30 bills, and this has doubled over the past 2 years. And we'll start with licensing. So vet techs is a bit of a patchwork. We have LVTs, RVTs, CVTs. Some states have title protection, some have limited, some have none. So with licensing, we saw, sorry, I have a couple notes here. Only a few bills, and this session, only Minnesota passed theirs, and it was in the last hour of their legislative session, and it was inside of a giant omnibus bill. And then just like licensing, scope is also pretty different across states. Some states dictate what vet techs can do under levels of supervision, some don't. And within those that do, those tasks are different under each level of supervision. Colorado, Maryland, and Utah passed bills establishing these basic duties and supervision requirements. And those also have room for their regulatory boards to weigh in and fine tune those details during the rulemaking process. Notably, California also has a bill that would allow an RVT to perform neutering on cats. This has been parked in committee since May, but only, I think, 4 states allow vet techs to do this under some level of supervision. So I'm interested to see where this will go and if it will spark any further legislation.
So one of the questions that I have, and I'm unmuting you, Katie, because you mentioned it earlier. You had mentioned that there were going to be 30 changes within states. Are any of those states dealing with this veterinary technician issue that we are aware of right now?
They haven't announced where those state leadership changes
Oh,
will be
okay.
yet. It's the prediction based on outgoing leadership changes. So there's nothing concrete yet, but
Okay.
I would imagine that absolutely with 30 chamber changes that something will overlap with the veterinary tech issue.
I'm just going to say our chief veterinary technician officers in North Carolina, we're just checking. We're just seeing what's going to affect Shannon. Okay, as we're going forward. Okay, anything else to add on that one?
I'll
Lauren?
keep you updated on that one
Okay,
specific.
thank you, thank you, thank you.
Closely related is Florida had their mid-level professional bill this past session, and it didn't pass, but it's not entirely different from the Colorado bill. And I want to point out Florida is a state where vet techs aren't licensed. So I think this is where some of the opposition came up with introducing a bill for a different profession when I think vet techs are still looking to be licensed there. And Sam, if you have anything to add to that point, feel free.
Yes, I mean, I got you, Sam. I got you. There you go.
I don't really have a lot to add there. I mean, I think when you say unlicensed, I think it's important for everybody to know that that means there's no state oversight, and so they have a voluntary credentialing process. So there's a few states that still have that where the vet techs aren't mentioned in the Practice Act in any way. So
Thanks for clarifying that. And that's all I have for vet techs and mid-level.
Any additional comments? Because I know we got Janet here, we got Shannon, we got a few other techs on here. Any other additional questions that you all might have with regards to the rulings of the technicians? I'm unmuting you, Janet. You look like you were leaning in.
Catherine, I'm going to weigh in very briefly. I think everybody watching tonight and participating should expect that next year and the following year and the year after, you're going to see increasing legislative interest in scope of practice and opportunities for non-DVM professionals in the veterinary space, credential vet techs, getting licensed, dealing with all the collateral issues around licensing, the veterinary PA we've talked about already. And I think that I do not see anything that's going to slow that activity down. Why is that? Because I don't think the demand from pet owners to have care, we now know that 52% of all pet owners are millennials and Gen Zs. They want the same level of care for their pets as they have for themselves. They've made that clear in every survey they've ever been asked. So if the veterinary system is being asked to provide human scale of healthcare, I think each of you might look at where we stand in veterinary healthcare and say, we're not set up that way. We've had a very veterinarian-centric model for 30 years, and it's worked. But the point is, the demand now and the number of pets is such that you're going to see, I think, in a healthy way, good discussions, but there'll be disagreements, I'm sure, about the licensing issues, the scope of practice, the range of practice, and you begin to see different levels of non-DVMs able to provide, and the state approving they're providing care to pets increase. And that's going to be true in red states and blue states. You'll probably see more of that in blue or Democrat states, just because there's greater interest and a tendency to want to be open to what you might call progressive or change-oriented legislation there. But don't think that this is done and wrapped up at all. And that's not a bad thing. But doesn't mean that there won't be disagreements among different participants. But that's the world we're in now, and I think it's going to expand as Lauren's summary accounts, going from 100 bills a year we track to 2,400. And when we track, that's carefully every day what's happening. So people have discovered pets in legislatures. Trust me.
So what I think is really cool, before I turn it over to Cheryl, is we had a conversation just recently and the veterinary technician said, we have the power now, so it's time to use our voice. So I do hope that that is now showing in the legislative efforts as well, and that we never forget the power of our technicians. So if we can advocate as much as we possibly can for them, the Bridge Club doesn't take a lot of sides, but on that one, we take a big side on. So as much as we can advocate for them. Okay, Cheryl, off to you.
Okay, so actually I'm just teeing it up to Lauren to talk about the xylazine legislation. There's a lot of bills going on about this drug.
Yeah, so xylazine is one of our newest issues. In this session alone, we saw 55 bills. So this is a veterinary sedative. There's no FDA approved human uses, but it's illicitly and recreationally being used, often paired with fentanyl or opioids. I was at the National Conference for State Legislators this summer and attended a panel on this because it's just devastating communities, which makes sense as to why we're seeing such a high volume of legislation introduced. The problem is about half of these bills that were introduced included no sort of veterinary exemption, because they're not aimed at veterinarians. So it just kind of gets overlooked. But we reached out to each of these states, and each state that passed a bill ended up including that veterinary protection. So this is one of those issues where we weren't looking at before. It's new in general, but where we were heavily involved, and saw a lot of volume.
Yeah, that's great because it's definitely a drug that's used a lot, especially surrounding, you know, sedation and pre-euthanasia, that kind of thing.
Yeah.
Okay,
Yeah.
any questions on this, the future impact? No, okay, we're just making sure as we're going on, because seriously, we're getting to the end. Like, we are very good for Dr. Douglas, your first one. We are tight as we do this. Okay, let's go repayment programs. Like, this is a big deal. Oh, come on, let's give the detail on that one, Lauren.
So this is one where we've seen high volume, and that volume's increasing rapidly. We saw about 35 this past year. Mostly they're targeted at large animal, rural shortage areas. In fact, we only saw one bill this year. That was a general loan vet repayment bill, and that was in Hawaii. Unfortunately, the majority of these bills are study commission bills. So they are creating a study group who can look at shortages. And 4 passed this year, but all 4 that passed were along the lines of a study commission or revisiting an already existing vet loan. So we didn't see any really big movement allocating funds for veterinary loan repayment.
Okay, so what does that mean for the future, though?
25
bills, that's a lot. That's a lot.
Lauren, let me take that question, because just due to how many years I've been involved in this, I've watched it. Because the repayment bills are focused on rural locations, guess what? There aren't many of rural legislators.
Right.
Legislatures across the country, Colorado is a great example, are primarily urban and suburban. And so it's even been true in Congress. There's been great effort to say we need more. Of course, we need more everywhere, but we need more rural veterinarians, mixed practice, and so forth. But the trouble is you don't have the political base, which means power, and power is what makes things happen in legislatures. It's not just good ideas win and bad ideas lose, I can assure you. So and Lauren and Katie and I have talked about this. These bills come up and everybody's heart says, great idea, but there just aren't enough people knocking on the doors of every other legislature in a suburban or urban district saying you should support this, because to them, it just doesn't really affect their constituents. And so I think if the industry wants to see these succeed at a faster clip, you're going to have the provisions extend beyond rural large animal locations, not exclude them, obviously. And that'll be more political. That'll be more controversial. Why should we care about a veterinarian practicing in a wealthy suburb? Why should we give them a loan repayment break? I'm just telling you what the other side will say. So that's the reason it's been slow, Catherine. I'm not sure the pace will pick up either. As Lauren just noted, you have commissions and they study it, but we don't often hear about legislation coming out of those commissions, right, Lauren? They kind of sit there. Yeah.
So before we go to our final topic, I am going to throw a little bit of a curveball at Mark, which he knows nothing about because it just popped into my head. So that's what happens at the Bridge Club occasionally. So we know there's been some oversight in looking at our corporate practices, one corporate practice in particular within veterinary medicine. Do we see more of that continuing? Do we see those type of investigations happening? We know Elizabeth Warren's been looking into them. Do we see that before we jump into what's happening in 2025?
Take me 30 seconds. Elizabeth Warren, the senator, U.S. senator, not state legislator, and bear in mind, basically, veterinary medicine is a state government issue, not a federal one. She's not looking into anything. She made a press release in an interview with Rolling Stone magazine. She's free to do that, raising questions about a particular corporate practice. That's all that's happened. So I didn't see a chorus of things, a great army follow that. There's been no follow-up.
Okay.
Elizabeth Warren's now a member of my minority party in the Senate, so she doesn't have as much power today as she had 2 days ago. So as you might indicate, I'm probably not a big fan of launching a federal investigation of ownership of veterinary practices. So I don't know that we'll see much more, Catherine. There you go, 30 seconds.
And I appreciate that. I just know that there's been some additional buzz, so I want to go through that. So I do want to have you talk about, and now give the floor to Mark, and thank God he's got stable internet right now for the second that he does. Let's talk about the 2025 priorities. I encourage anyone who's got additional questions, because we will stop at the top of the hour. Any additional questions that you have, I promise you with Katie's approval, you all will get this report that the Animal Policy Group has put together, along with this video and also the audio. So you'll all get that from me tomorrow, but I wanted to be sure that we're also looking ahead at 2025 before we end.
Real quick, and I'm going to kick it to Katie for half of this regarding animal welfare. We do a lot of work with animal welfare organizations, so Katie's got great history and expertise there. The main area we see activity every year, and it picks up every year, is pharmaceutical. Okay, it relates to every aspect of pharmaceuticals, mainly driven by the opioid crisis, and then the question of having veterinarians report, watching xylazine, as Lauren's covered, and she works on extensively. So I think you'll see more of that when people get elected, as just happened yesterday, and state level, the same as federal. They come in January with a lot of enthusiasm, as Katie knows, as a longtime lobbyist in state legislatures, and not because they promise things to voters, but because now they've got power and they want to do something about it. So we'll see more bills this year, and we'll see a lot of activity. Years that you have elections, like we just finished in 24, legislators have one goal: go home and run for re-election rather than spend a lot of time. So this will be an active legislative year, but no state had one topic really dominate it that affects this industry, but we'll still keep creeping up from 2,400 bills to 2,800 to 3,000. But my guess is pharmaceutical will be most of them. Katie, do you see anything on the animal welfare side that might be interesting?
Yeah, absolutely. So increasingly, as you can imagine, animal sheltering organizations are concerned with their ability to find a veterinarian to work with their animals. And so because of that, we are seeing a huge overlap with animal welfare legislation directed towards increasing access to veterinary care. And veterinary care issues in general. So one issue that is just completely blown up, and just the Journal of Shelter Medicine posted a new article today, is spay and neuter. There are more than I have ever seen before, but this session, 21 bills were introduced to ask for state funding for spay and increased amounts of spay and neuter. So state funding that would pay veterinarians in different states to perform more spay neuter surgeries. I expect that to possibly double next in 2025. So that is money that the state is giving to veterinarians, to local vet practices, to actually perform spay and neuter in their communities. The article that came out today in the Journal of Shelter Medicine basically says that of all the animal sheltering organizations that were surveyed, more than 90% responded that they are backlogged on their spay neuter surgeries. So this is a critical issue that I think we're only going to continue to see more of. I've even had, I recently had a call from a very high level legislator who basically told me that they want to possibly look at millions of dollars in state funding next year for increased spay and neuter. So that's one thing. Another thing that has really popped up and we saw a lot of, and I think we'll see more of next session, are elective procedure bans, specifically declaw. There were 20 bills filed across the country this session that would prohibit veterinarians from performing a declaw surgery for anything other than a medical reason. The only state that passed that legislation was Virginia. But I anticipate that there will be more states to do that next session. Finally, a couple of 3 or 4 states all introduced legislation that would allow human EMS workers to treat pets in some capacity. New York passed a bill that would actually allow EMS workers to treat any pet in emergency aid. And Maine, Nebraska, and Virginia are allowing EMS to provide medical aid to law enforcement dogs. So these are just some of the ways that animal welfare laws are very much intersecting with veterinary medicine. And if anybody has any further questions about those, because there are others, but I'm always happy to talk more about it. But those are the 3 that come to mind in terms of volume of bills that we
Okay,
saw.
so I knew nothing about that last one. My heart just was like, I was waiting to look at everybody's faces if everybody's camera was on. Did everyone else know about the EMS workers? Am I the last
And
one?
I also want to know, like, what about the other way around? Are veterinarians allowed to work on people in an emergency?
Yes.
Maybe in an emergency. If I were a human in an emergency, I would have no problem with that. That's for sure.
I love how I should clarify, I'm not a veterinarian technician, so 90% of the time I act as a consumer, but I did not know this. If Cheryl's not shocked, I guess I shouldn't be shocked. So just kind of leave it at that. I love all of this. Okay, we are at 7:56. So any last parting thoughts, Mark, before I jump in?
No, appreciate it. And remember, we've had 240 years of elections in America, and America survives each one, and everything changes quickly and comes back for the next round 2 years later. So I'm always fascinated by how it plays out, and it swings and swings and swings, and it'll keep swinging, I'm sure. Thanks for the show, though, Catherine. I think this is a great topic.
This is an amazing one, and people are really going to want to listen to this one. I do actually want to call out Sam really quick here. So Sam is doing something tonight that we at the Bridge Club truly, truly believe. We are people first. So we are moms, we are dads, we are brothers, we are sisters, we are husbands, and we are wives. And so thank you, Sam, for bringing your little one on the camera. This is really important because we have to live our lives, and we also have to help the community around us. So I do always want to call that out to say this is the best thing that we can possibly do on the Bridge Club, because it helps build more bridges and also makes us realize that we all have emotions and we all have feelings. So I really want to look at that as we are specifically talking about legislative review. Huge thank you to Katie and Lauren, Sam, who jumped in, April, who would have thought? Never even realized she was coming on. Mark later told me he had invited her on, and especially to Mark Cushing, all of the animal policy group. They are a supporter of the Bridge Club, but more importantly, every time they come to the table and bring topics, they are important for the profession to hear. And tonight's conversation is probably the most timely conversation we have ever had in our 7-year history. And so I am very excited about what this will do for others, for them to listen to. As promised, I will be sending out the document so you all will be able to receive it. I didn't indicate earlier, I am one of the founders of the Bridge Club. Both Cheryl and Shannon are also a part of the Bridge Club. We have some amazing things happening in 2025, so please watch us. But it only happens because of people like Mark and Lauren and Katie and Sam, and I'll add in April, because they are following what is happening in veterinary medicine. They are the ones that are the eyeballs when we are off doing our daily work. When Dr. Douglas is in his a truck and he's helping patients, they are the ones looking at what's happening around us and being able to take care of us. So I want to raise a glass to their dedication for keeping us aware of what's happening. We may not always like it, but at the same time, they are helping us advance veterinary medicine. So thank you so much, and cheers to everybody.